Hello, this is Farah Douglas, President and CEO of the Liver Health Foundation. Thank you for joining us this evening. We are hosting a very important webinar tonight on how organ donation can save lives. I'm going to shorten my remarks by just saying that Liver Health Foundation is a California-based 501c3 entity, which means contribution to Liver Health Foundation are tax deductible. Our mission is to provide updated and accurate health information to the community through webinars such as tonight's program. To see the complete list of our programs and events, please visit our website, liverhealthfoundations.org. I need to thank Dr. Sami Saab for being the host and MC of the webinar tonight, Mr. Tom Moon, Chief External Affairs Officer and Vice President of the One Legacy Foundation, for being our speaker, and our special guest, Mr. John Whalen, who will share his story with us in a little bit. Liver Health Foundation is deeply appreciative of One Legacy's generosity for being the exclusive sponsor of tonight's program. Without their help, we couldn't bring this life-saving information to you. Now a word about our sponsor. One Legacy will celebrate its milestone 20th anniversary Donate Life Run Walk with an in-person event on June 4, 2022. We hope you will join the One Legacy team and Philip Palmer, ABC 7 Los Angeles news anchor, in celebration and support of One Legacy's essential mission of organ donation awareness. The One Legacy Donate Life Run Walk is a non-competitive run walk and features performers, politicians, and celebrities presented by the One Legacy Foundation. The Run Walk exists to educate and inspire the community about organ, eye, and tissue donation, to honor donors, their families, and to inspire others to donate life. One Legacy hopes to help more recipients this year than ever before in the charity's history. Sadly, 22 people every day die while waiting for the life-saving gift an organ donation offers. Together, we can change that. Please go to donateliferunwalk.org to register and learn more about the Run Walk. We thank you, One Legacy, for their generous support of our efforts. It is now my distinct honor to introduce the chair of the Liver Health Foundation's Medical Advisory Council and our distinguished MC, Dr. Sami Saab. Dr. Saab has partnered with me for the past 7 years and has helped us provide the programs and services we offer to liver patients and their families. It has been wonderful to work with and to learn from. Dr. Saab is Medical Director, Fleger Liver Institute, Medical Director, Adult Liver Transplant Program, Chief Transplant Hepatology, Head Outcomes Research in Hepatology, Professor of Medicine and Surgery, Adjunct Professor of Nursing, Professor, California North State University College of Medicine, Associate Editor of Liver, Journal of Clinical Gastroenterology. These are some of the titles that Dr. Saab carries. With all of this on his plate, he always finds time to help and support our efforts. Thank you, Dr. Saab. Would you please start the program?
Yes, Farah. Well, thank you for asking me to participate today. I am very excited about tonight's speaker. It's funny, we're always affected by our first impressions, and I heard Tom give a talk maybe 10 years ago, and he was fantastic. Before I introduce Tom, I want to introduce everybody else. I want to thank people for joining the webinar and participating as advocates of liver disease. And thank you, Farah, for making this possible. So Tom is a Chief External Affairs Officer of One Legacy. He's a Vice President of One Legacy Foundation Operation. For the past 2 decades, Tom has led One Legacy the country's largest organ recovery, serving over 20 million people, over 200 hospitals, 10 transplant centers. In 2020, One Legacy, which Tom leads, recovered over 500 organs, donors, 1,600 organs for transplantation, and over 2,500 tissue donors. He's doubled and tripled organ donation since the arrival 2 decades ago. Tom leadership has led the One Legacy to be the one of the first in the country to have electronic donor records and web-based organ placement systems, real-time testing of all organs using nucleic acid, working with DMV on Donate Life California registries, working on Living Donation California referral programs, being active in donor coordinator role specialization. He's very keen on patient advocacy and breaking down barriers, and he's also led the effort for Spanish language paid media advertising, multilingual family care staff, and the list goes on and on. But in addition to being an incredible leader and advocate for patient care, he's a tremendous speaker. And I think we're all very lucky to have him talk to us today about organ donation. So without further ado, Tom, take it away.
Dr. Saab, thank you so very, very much for that very generous introduction. It is certainly my pleasure to be here today. And what the audience may or may not have gleaned from that introduction, that is, for the last 22 years, I have in fact headed up One Legacy as the CEO. And just this week, we have elevated my former Chief Operating Officer, Prasad Garamella, to be this new CEO of One Legacy. But you can't get rid of me that easily. I'll be staying on to continue to do external affairs, public education, following up on that patient advocacy and increasing donation into the future. So it's very, very pleasure for this to be my first presentation in this new role. So thank you very much for the invitation. I have brought a slideshow, which I think is an easy way to move through. It gives people some visuals. I won't spend a lot of time reading the slides at you, but I'd love to talk about them and welcome questions as we follow up. If I can, I will share this. So see how my skills are. We got this. Make it a little larger. I think, are we all good there? I think we are. I'm going to move ahead. Presentation here. Just as a reminder for those who may not know, we're One Legacy. We are the organ procurement organization certified by the Medicare program to cover these 7 counties of Southern California as our service area that we provide for. And that the unique part about our area is we are by far the largest organ procurement organization in the U.S., serving 20 million people. Our nearest other OPO serves about 12, and the average serves about 5. So we're very unique in that way. Probably most important, of course, is that we are the most diverse region in the country, with 70% communities of persons of color, which is the nearest to that in the country is maybe 50–60% persons of color. Clearly, we have a unique community here. We'll talk a little more about that in a moment. I mentioned there's 57 federal designated organ procurement organizations, and we have 3 main roles. We have a very public role in educating to increase organ donation and organ donor registration. We have a role to advocate to the federal government and state governments to improve laws to make donation easier. We created the Donate Life California registry, the little pink dot on your driver's license, back in 2005, and through the course of 3 different legislative bills, got it connected to the DMV. And now we are the largest registry in the nation, with 18 million Californians registered, for example. But our day job is following up on organ, eye, and tissue possible donations, and we received some 9,000 possible organ donor referrals every year from hospitals, and another almost 90,000 possible tissue donor referrals from hospitals and coroner's office for bone and skin and corneas and heart valves and the like. So a lot of very upfront work. We follow up on 100% of these referrals on site, on phone, on a regular basis to determine donor suitability. And of course, the vast majority are ruled out for reasons of, hopefully, in the best days, some recover and go home. Other days, their unfortunate contraindications of cancers and other diseases prevent their donation. So 9,000 possible organ donor referrals will winnow down to about 600 or 700 possible actual donors. I think, as Dr. Saab may have mentioned, we have 200 plus hospitals in the area, 10 transplant centers. But of course, these days, organs can go anywhere in the country. And on a regular basis, we'll be working with 25, 30, 40 different transplant programs around the country every day. Probably most important about this slide is a mention of our team. Our team is a remarkable, of 325 staff members, a remarkable mirror of Southern California, the ethnicity, language capabilities, and the like, really very much a part of our community, because we draw from our community, and because we want to make sure that when we're working with a family who's just lost a loved one, that the people working with them understand them culturally, linguistically, and can care for them in that very sensitive time. A reminder in organ donation that a single organ donor can save up to 8 lives with 2 kidneys, that's 2 transplants. Liver can be split into 2, so that could be 2 more transplants, 2 lungs, 2 more transplants, and heart and pancreas. And on the very rarest of occasions, the small intestine, especially for pediatrics. So you could really say 9 lives. And the average eye donor, cornea donor, can give sight to 2 people, of course, one cornea from each eye, and bring sight back to individuals. We have the One Legacy operates its own eye bank that does the recovery, the processing, and the distribution, and one of the largest eye banks in the world at this point. And a tissue donor who can donate bone and skin and cartilage and the like can help heal up to 75 people. So a single donor has tremendous impact on the world and the lives. One of the factors that people don't often realize is when I talked about that 9,000 referrals winnowing down to 700, 800, 900 possible donors, even before talking to families about authorization or determining if someone's registered, that's meaning about 10% of the, about 1% of the potential cases. And that's really what it boils down to. Fewer than 1% of people will die in such a way that we can actually become donors. So it's about around the country, around the region, there might be about 130, 40,000 deaths. In reality, we end up having about 600 or 700 organ donors. It's such a rare circumstance to be on a ventilator and brain dead and have organs that are viable for someone else, which is why every single donor matters. And we strive to help everybody see the value of choosing to register as a donor. We know nationwide about 70% of people, of donors choose to donate at the time of death or are registered, and that's a very positive sign. But the fact is, as long as people are on the wait list, we really need to keep helping people see the value of registering and donating. This last year, Dr. Saab spoke to our 2020 performance. Last year was another record. We've set records, I think, 7, 8 years in a row here at One Legacy. This is a record number of organ donors at 591, and a record number of organs transplanted at 1,688. And this was despite, the last 2 years we've set records despite COVID, which is a real testimony to our team, because COVID did rule out a lot of potential donors, prevented others from getting into the hospital because the ICU beds were filled and they couldn't become donors. But we were much, much more rigorous and vigorous in making sure that every referral was quickly followed up. And when possible, we would, when someone who had authorized donation, who had already been declared brain dead, we would transfer them to our Redlands, One Legacy Redlands Recovery Center and do the recoveries there, and thereby free up an ICU bed and staff to take care of the many hundreds of COVID patients in the area. So it was a benefit to the hospital and certainly to their patient population for us to move those donors, and it allowed us to save more lives than ever. There's often questions, how does the US perform relative to the rest of the world in organ donation? I can say quite proudly that the United States is the #1 in organ transplants population of any country in the world, well ahead of every country. The nearest competitor, and it's a good, healthy competition, is Spain, which has always had a very high donation rate. But even now, in donors per death and donors per population, the US exceeds Spain in donors as well as in transplants. And we have twice the donation rate of the developed programs of Europe. So we're holding our own in the world. And it continuing to improve. So those are all very positive things. Right now, last year we transplanted over 40,000 organs in the US. And if you go back literally a decade, it was in the 6 or 7,000, the 18 to 20,000. So we really pretty much doubled organ donation in this period of time. I could talk about our staff and our team. We definitely seek people who represent our communities, but we also have a very focused multicultural competency training for our teams. And we have we're really developing our grassroots community partnerships with community-based organizations and businesses in the many communities we serve, whether it be African-American communities, Latino communities, Asian American communities. We especially focus in these communities where there are new immigrants. People have come from other countries, other cultures, where donation is not common. And sometimes there's misperceptions about whether donation is acceptable to people's religions. By the way, it is to every major religion in the world, but people don't always know this. So our partnerships with churches and synagogues and temples help share that message with their communities. So these reaching out and being part of our communities are very diverse, very complex communities here in Southern California. It has enabled us to have a higher than average donation rate among the communities of color, about 69% here in Southern California compared to the 62% national average. So some progress made here, but still work to be done, because you'll see a little later the rate among the multi-generational English-speaking community is up in the 80s. Dr. Saab mentioned a number of the innovations we've done. We did create the world's first electronic donor record, and that offered organs over the web in order to get more offers out there and find a match and save a life rather than run out of time, which would often happen when we're on the telephone doing this work. We were the first to do nucleic acid testing to verify that donors did not, in fact, have HIV or hepatitis C or hepatitis B. And we knew that the testing was pretty good on that to begin with, but once we did the real-time nucleic acid testing, we were able to build surgeon confidence and patient confidence in accepting organs, and ended up getting more organs transplanted. So that was very positive in every way. And one thing we've been advancing on the last few years is having very much a physician-driven organ donation practice. We have a intensive care physician who has done donor management on more donors than anybody in the country. He happens to be based in Baltimore, Maryland, at Shock Trauma Center. And we work with him through telemedicine and have for the last decade. And it's been a very positive relationship with Dr. Abashi, who does this. We have Dr. Rosemary O'Megan, who is an intensivist formerly of Hoag Medical Center, Newport Beach. We use every one of our referrals and helps us determine suitability and work with the hospitals to make sure the donor opportunity is preserved. And some recent expansion into palliative care. The new Dr. Adam Kendall, who's a palliative care physician, to help families in their time of loss and grief make something good come from their loss. And he himself is a donor husband, so very personal to him. This is a picture of our growth over the last decade. You can see year-to-year ups and downs in organs transplanted, but the net of the curve has grown pretty substantially. And we have every reason to believe it will continue to grow this year. We absolutely believe that in the next 3 to 5 years, we will be at over 2,000 organs transplanted a year. This is a picture of organ donors. The number of organ donors, 592 this last year, and the number of livers transplanted from those donors, 362. And I put this here to show that we're transplanting 61% of our donors' livers, and that compares to 63% nationwide, pretty close actually. And the reason you're seeing this gap starting to grow a little bit is more and more of our donors are donors after cardiac death, not brain death. Donors who are been determined by their doctors and their families that they're not going to recover. They're going to turn off the ventilator, but they do it in a controlled fashion in the operating room. And if that donor's heart stops beating within an hour, the organs can be recovered. However, transplant surgeons find that anything over 20 minutes, and there's potential that it'll have impact on the liver function. So a lot of this growth in our donors come from these DCD, donors after cardiac death patients, and not all of we're not able to use many of their livers as you can from brain dead donors. So we'll probably see this gap expand a bit, but if we keep increasing donors, we'll still see that liver number start to rise again. This is actually a reminder of the difference in our population. You can see the One Legacy population, it's 31% white population, 45% Latino, 14% Asian. Both of those numbers all much higher in the Hispanic and Asian than the rest of the country. You can see the rest of the country is 60% white versus One Legacy is 31, 13% Black. And it's just a reminder of how diverse we are and how different we are from the US as a whole. This graph shows you how we do an authorization of brain dead donors, and this is nationally shared data from all of the organ procurement organizations and managed and captured by the United Network for Organ Sharing, UNOS, where all the patients are registered. And you see the authorization rate over the last 5 years, 3 or 4 years here has been is 87%, US 85. Our rate in the Black community has been 58% versus US 55, Latino 73 versus 71. And so you can see we are certainly doing well and doing better than the average. But the opportunity here for us and for the whole country is to increase those bars for the African American, the Hispanic and Asian populations in particular, to be up with the mainstream white multi-generational English speaking population. And that again gets back to being part of communities, getting into the grassroots, breaking down myths and fears and distrust, which is very common among recent immigrants, and it's certainly very common in the African American community, which has had very unfortunate reasons to mistrust the medical system. And we work every day to try and earn that trust back. And I'll just share an anecdotal story. We have ambassadors, you'll hear from one, John Whalen, in a few moments, who do tabling events all over Southern California. And a few weeks back, we had a table at the Department of Motor Vehicles, the DMV in Inglewood. And one of the people in line saw the table and said, "I'm not going to register to be a donor because my people don't get transplants." And one of our staff volunteers at the table said, "Well, I'm your people, and I got a heart transplant." There's the 2 African American people, the person in line and our ambassador, and the gentleman said, "You got a transplant? Tell me about it." And she told the story of her heart transplant. And the people in the line were fascinated and were asking her questions. There on this gentleman, 4 or 5 other people just registered because she helped prove the point that there's a lot of myths out there, and in fact they are not true. And African Americans and persons of color certainly do get transplants, and we'll see that in just a moment here. In fact, this is where we see it in the U.S. Persons of color make up 31% of the population, or 32% of donors, and receive 48% of transplants. So disproportionately, persons of color receive transplants at a greater rate than the portion of the population. In One Legacy service area, 69% of our population, 70 is persons of color, and make up 68% of our donors. So pretty much on par with the population. And persons of color receive 73% of transplants in our area. So the myth that persons of color don't receive transplants is in fact just a myth, as the data show. But there is a challenge here because persons of color make up more than 60% of the US waitlist and more than 82% of our waitlist here in Southern California, because the need for transplant is greater in these communities. In part because the prevalence of diseases like liver disease is much higher rate in the Latino population due to genetic and dietary reasons. The prevalence of kidney failure is 4 times greater in the population than the white population, and a couple times greater in the population than the white population. So the need for transplant among our communities of color are higher than the overall population. So our work remains cut out for us, but we continue to ensure that people from those communities and all communities who the person of the greatest need gets the transplant. The next, this was a reminder again in probably too much detail, the relative populations percentages here, and One Legacy area in the dark pink, and the California, One Legacy transplants, and then the California population in dark green, and then the California transplants, and the U.S. population in the light dark orange and light orange, the transplants. Just a reminder how we there's relatives around the country in transplant rates, relative based on ethnicity, but the distribution by region of the country, of course, is dramatic. Becca, I would just like to sort of wrap by saying that we have a very, very big challenge here because we have so much of our population are fairly recent immigrants, and that's a challenge both in the need for transplant and it's a challenge in the willingness to donate. But we, as you see, we continue to make progress year after year in building on this, and we very much welcome our collaborations with community-based patient organizations, and certainly the Liver Health Foundation in getting this message out to the broader community that we serve about the need for taking care of people in one's own family, own community, because you never know. The need for a transplant could strike any one of us. And I can say this as someone who had never had any need for transplant or knew anybody in my family who needed one. And about 5 months ago, I had a brother-in-law who had a successful liver transplant where he lives in Florida. And it was only the generosity of a donor who chose to give the gift of life.
So I can go through a couple of questions, that's okay. One of the questions is, and maybe Dr. Caldas could help answer some of the questions.
Let's ask Lori to turn on. Oh, Tom is back.
All right, good. Sorry about that.
Bizarre, thank you.
But you had left it out before we lost you the first time was on transplant equity. Gavin Sweeney just reminded us.
The equity of access to transplant shows pretty clearly that the persons of color disproportionate to the enrolling population get transplants here. About 72% of our transplants, 73%. Have gone to persons of color, while in our community about 69% persons of color. So that's a very positive sign that there is access, there's insurance coverage, and the person who gets it is not a function of race, color, or socioeconomic status. It's a function of who has the greatest need and the best match. And that's very positive. But the need in those communities is even greater, and we have to continue to help people from our communities of color choose to register and donate, because the need may benefit them and their families and their neighbors, and being taking care of themselves and taking care of our community at the same time. And that's what we spend our time doing. And I just want to again thank Farah and the Liver Health Foundation for allowing us to share this message today.
Thank you, Dr. Saab. You want to start?
Oh, yes, Tom, that was excellent as always. And there's so much data, but we appreciate you kind of, toning it down for us and make it very accessible. So at this point, we'll take some questions. If you don't mind, Tom, I'm gonna read off some questions that have been sent to us. Let me just minimize my screen. So Tom, one question that's been asked of us is there an age cutoff for donation? So someone emailed us, Tom, that they want to be an organ donor and they're 70 years of age, and they want to know if the organs are still helpful to other people.
That's a really good question. We have a program a line we use a lot, which says, don't rule yourself out. Don't make a decision to reach your own conclusion that you're not potentially a good donor. And the reality is this year alone, there was a 90-plus-year-old who was a liver donor in this country. And wow. That's very rare, but it does happen. We routinely follow up every referral for every possible donor who's up to 80 years old. That's where we do our cutoff. And if there's an exceptional case, we'd follow that too. But 80 is our upper limit right now.
Okay, excellent. And another very important question is, from the audience is, what would be their condition? What would be the condition of a deceased body? People want sometimes open caskets, and is that possible after organ donation? Would there be any visible signs of surgeries or removal of organs?
We make certain that the recovery surgery is roughly, it looks roughly equivalent to maybe a heart surgery and abdominal surgery, and the body is properly prepared by the morticians, and we will help them in that process. So people routinely have open casket funerals after being organ, eye, or tissue donors as well.
That's really important for family members who are thinking about donating. Here's another good question, and this was in the news, unfortunately, about 5 or 10 years ago. Someone asked or says that my biggest fear is that if I donate my organs, the doctors will cut me up before I'm actually dead. Is that possible?
It is not possible in this system because there's such incredible oversight of organ donation processes, the need for 2 declarations of death, the need for documentation of the brain death testing, the heart to, if you have a donation after cardiac death, for your heart to have been stopped for 5 minutes before you start doing any recovery. And the most important thing to remember is if the effort is not made to save your life, keep your organs perfused, on a ventilator, getting oxygen, getting fluid to try and save your life. If they don't do that in the first place, your organs will likely die before you do, and they will not be good to anyone else. So the organ donation process does not actually begin ever until there's absolutely independently declared death by physicians who have nothing to do with donation and transplant, physicians who are just caring for patients in hospitals.
Yeah, very reassuring. Another question built on a previous one I asked you is, I'm an organ donor. Who will have custody of my body after I die? Is it recovery agency, transplant centers? And when will my family get the body back for burial?
Yeah, the routine process is that as soon as the recovery is complete, and if it's done in a hospital, the hospital staff move the body to the hospital's morgue, just as they would with any other patient who passes away in the hospital. And then it's coordinated through the family's mortuary and the hospital. Because One Legacy is one of the 8 or 9 OPOs that has its own recovery center for some of our cases, that would be transferred to our facility, our morgue, and then your mortuary, just like anywhere else. So that's a standard handoff, and it works identically to really what works in hospitals.
Another good question, Tom, is, as you know, we live in Southern California, a lot of sun exposure. So someone asked, I have skin cancer, and we just told, unfortunately, I have breast cancer. Can I still donate my organs, skin cancer and breast cancer?
The general rule of thumb on cancers is if somebody is a 5-year plus survivor, you can be an organ donor. If it's currently active, you could not, but there's no reason to make any decision about your registration because that would all be verified during the donor workup process. So look forward to recovery and know that in a few years, if the circumstance came to be a donor, it would be allowed. It would be okay.
Another question is, what organs are in most demand? What organs are in short supply?
All organs are in short supply. By far the highest rate of transplant, of the 106,000 people on the transplant waiting list, 100,000, as many as 100,000 are waiting for kidneys. That's in large part because dialysis allows so many kidney patients to survive, but not thrive and not live independent of machines. So they can wait for a transplant for many years, which doesn't really hold with the other organs. We're seeing a little bit of more growth like that in heart transplant, where assist devices allow patients to wait longer and wait for the right transplant. But all organs are in short supply. And, we are therefore, we're very excited to see the remarkable progress made in the last year or so in the potential of xenotransplantation, animal. Using pig organs, for instance, a case of a pig heart recipient who lived 2 months with that. If the first time it was done in human history successfully, if even more than a day or two. So some real potential progress, because at the end of the day, there will never be enough deceased donors to serve everybody who suffers organ failure, and only those who will get the greatest benefit out of it right now are listed.
Thank you, Tom. Another question is, someone's very impressed with the numbers. And they want to know if their organs are, if they donate their organs, would it be used locally or sent to other parts of the country?
Today, about 75% of the organs we recover are transplanted in the local Southern California area. Our transplant distances are about, the first round of offers are about 250 miles, which mostly includes California. A few may get transplanted in Las Vegas, or I'm not quite sure they get to Phoenix, but mostly in Southern California. Of course, if there's not a match, then they get offered across the West and across the country.
And Tom, a very important question, and we touched upon this before the program started, is will the recipient or his or her family have access to my family's contact information? Do they have to meet with the recipient family members? And they say that it could be very painful for that meeting to occur.
Yeah, every opportunity of every donor family who donates and any recipient who receives a transplant, they have the opportunity to reach out to one another with, I'll call them anonymized messages. So we often get letters of gratitude from recipients written back to their donor family members. We will make sure that there are no names or identifying information so they contact each other, simply share the message, and we'll pass that on to the donor family, and vice versa, working with the transplant centers. If both parties say they would like to meet, then there and only then are those meetings arranged, and they're routinely arranged at One Legacy or with some of our colleague facilities, and have with social workers present and like to help families go through the very motions of those meetings. But I will tell you, those meetings are almost always incredibly fulfilling and gratifying, and ultimately joyous of chances to see the good that came from somebody leaving a legacy of life.
Yeah. We have a question from the chat room, and the question is there a variation across the U.S. for MELD scores for transplant?
There is, absolutely. Areas with a higher prevalence of liver disease are going to tend to have a longer list, and patients are going to get transplanted at a much higher level, higher MELD score. Places that have less liver disease in the community, and places that have a higher donor potential. And donor potential varies around the country. I was with some co-authors, and back in 2011, we did an evaluation of donors' potential around the country, and it very much follows what's traditionally known as the stroke belt of the United States, the unfortunate portions of the South and Southeast, where there's a higher rate of stroke and brain bleeds, that has the highest donor potential. So it is pretty well documented that MELD scores at transplant tend to be the lowest in the Southeast, and they tend to be highest in places like California and the Northeast, where you have a little bit lower donor potential, and here where we have very high need for it, especially with our Latino population and the prevalence of liver disease in this population.
Tom, we have another question, but I think it's directed to me. And the question is, what are the most common questions you find among people who just learned they have liver disease when you liver transplantation? I think the most common questions is, what's going to happen to me? What can I expect? How it's going to impact my life? How long am I going to live? When would I get a transplantation? And how will my life be after liver transplantation? So, there's a lot of questions. In our job, and we have people here on the attendee list that are physicians. Our job is make sure we hold people's hands and get them through this very painful process, because it is a difficult process. Especially for instance, if you have liver cancer and you have no symptoms, and so it's kind of hard to believe that you may have something growing inside you when you feel so good. Let me see any other questions in the chat room. I think that's it, Tom. Any closing remarks before we move on?
I would just like to express my gratitude to Farah and the foundation for inviting me to speak today. I very much appreciate our collaboration through the years, and we would certainly welcome any follow-on questions, and absolutely invite people to register to donate life. Check the box of the DMV or go to the registration pages as we shared earlier. So thank you all very much. And I know I'm very much looking forward to your introduction of John Whalen, our recipient, who I know is a wonderful, can speak to the value of donation and transplant for him.
Well, Tom, I want to thank you also. I mean, it must be so satisfying to go to bed at night and just think about all the lives that you saved and helped touch your in collaboration with all the different transplant centers. What a
Well,
great
Dr. Saab,
story.
I know you know some of that gratitude, and I think we're grateful for that, and we are just hopeful that we can help even more. So,
Excellent.
thank you
Well,
very much.
I want to introduce a very special guest tonight, who will be sharing his story about receiving a donated organ with us. I am very happy and pleased to introduce Mr. John Whalen to tell us his story and take us on his journey of what he went through. John?
Hello. I see. Is my video going? There it is. Hello, everybody. Thank you, Dr. Saab. My name is John Whalen. The reason I've been asked to speak tonight is my life was saved on February 27th, 2013. I'm a liver transplant recipient. So my journey started about 5 years before my transplant. I went through a period where I was really run down, had terrible shooting pains in my right side, and was having some mental confusion. I would go to doctors and they're just trying to solve the riddle, trying to figure out what was wrong with me. Finally, in June 2012, my wife and I were having a party, and I remember setting up for the party on Saturday morning. And the next thing I remember, it's Wednesday afternoon, I'm in the hospital, and a doctor explains to me that I have something called hepatic encephalopathy. He didn't let me know that they did a liver biopsy and that the damage he sees, he has to refer me to a specialist. So I went to UC San Diego, where my hepatologist, Dr. Robert Gish, diagnosed me with actually two diseases, which was causing my liver to fail. The first issue I had was I had a genetic deficiency. I was alpha-1 antitrypsin protein deficient. That's a protein that's created in your liver and protects your liver and lungs. Second thing I had was NASH, non-alcoholic steatohepatitis, or fatty liver disease. And so then Dr. Gish also informed me that my liver decompensated. So really at that point, the only chance I was going to have for survival was to get a transplant. So I was very fortunate that in January 2013, I was able to be qualified or go through the testing to get qualified for the transplant list. On February 22nd, 2013, I was actually placed on the transplant list. I received my call on February 26th, and I'll never forget that moment. My wife and I were at home. It was around 7 o'clock at night. The phone rang and I answered it, and they told me that they had a liver for me. And I just dropped the phone and just sat there in stunned silence as my wife asked me what was wrong. And I told her that I just got the call. And we spent the next minute trying to decide if we really needed a liver, if I really needed it. It was so crazy. For some reason, I was really nervous about getting it. But then I came to my senses. And when the transplant center called back, I said, I'll be right down there. So that next morning, I had my surgery on February 27th. My surgery lasted about 10 hours, and it took me about 24 hours to recover. And I just want everybody to understand, for me personally, this gift of life was such a miracle. My life was so difficult with the hepatic encephalopathy I had. I had a thrombosis in my portal vein. I had so many issues going on that, every day was a struggle. But now, just 24 hours after having that new liver put in my body, when I woke up in that ICU room for the first time in years, my head was light and it was clear and it was incredible. It was the most incredible feeling I've ever had. And it's the feeling that I knew that somebody had saved my life. And it's such a great feeling. And so, I wanted to thank this family, these people. So I wrote to them and, the letter, an anonymous letter, to let them know how much I appreciated it. So I was one of the lucky few whose donor family wrote back to them. And so I'd like to share a picture with you of the young man that saved my life. His name is Jason Gosnell. He's a 30-year-old father of two little girls from Phoenix, Arizona, who was a registered organ donor, and his family supported his wishes to be an organ donor. So Jason, through organ donation, saved 3 lives. He saved mine with a new liver. He saved 2 other people's lives through kidney and pancreas donation. Now, unfortunately, his heart and lungs were damaged from the accident, so he couldn't donate those. But through cornea and tissue donation, that young man, Jason, a real hero, he's saved or improved the quality of over 93 people's lives so far. So think about that. One person who made that decision to register to be an organ donor has impacted 96 people plus their lives, their families, their communities. It's such an incredible gift. It's such a beautiful, kind, loving gift. And we should always remember our donor families, because none of this would be possible for people like me, with those beautiful people who at that terrible moment in their life can agree to honor their loved one's decision or decide to donate organs from their loved one to save somebody's life. It's really incredible. And I'm very, very fortunate on this journey. You know, really the true hero besides my donor and his family would be my wife and my family and my caregivers. It's so difficult on them. You know, my spouse had to work full time, come home and take care of me. She had to get help from my family, her family, to constantly be there to make sure that I was monitored and taken care of. So it's a whole community of people that get to share in this beautiful gift of life, this second chance. And I just want you to know that I don't take any of this for granted. I'm so thankful for it and I appreciate it, that I do everything I possibly can to take care of it, from taking my medicine like I'm supposed to, changing my lifestyle to be healthier, eat healthier, exercise on a regular basis. I avoid all the foods that I'm supposed to, and I do everything that my doctors ask of me. And I do this because I never wanted to let anybody think that I would take such a beautiful gift for granted that came from such an incredible family to trust me with this organ to keep me alive and to keep the memory of their son alive. So it's really important to me. So what I've been able to do since my transplant, which is really incredible, is in these 9 years, I've been to 2 nephews' weddings. I've been to my niece's wedding. I have 3 great nephews. My older one, Joe, I was able to buy him his first chocolate dip ice cream cone, which I really enjoy doing. I have a new great niece going to be born on September 3rd, which is my birthday. So if that works out, I'm looking forward to that. I was here for my parents' 60th wedding anniversary. I was able to make the speech to honor them at that, which was really important to me, to let them know how much I feel about them and just everything they've done for me throughout my life. And my wife and I have been able to travel. We've been all over the Western United States on different multiple road trips. We even traveled to Paris right before COVID, so we were very happy to get that done. And I'm just so grateful and thankful for this. And so I just want the audience to know that this gift is really beautiful, and it's such an incredible legacy to leave behind. I want everybody who is not registered at this time to think about registering. Think about being like my donor, Jason, and think about leaving a legacy of love and have a really positive impact on your community, which is what donation does. So thank you, Farah. Thank you, Dr. Saab. Thank you, Mr. Moan. Thank you for inviting me here today to share my story and talk about my donor, Jason, and the incredible gift of life that he gave me. Thank you.
Thank you, John, for the wonderful journey discussion. And you, by the way, you look great.
Oh, thank you.
I'm sure you get all the time. People probably don't believe you even had a liver transplant.
Right.
And
Yeah,
this shows a
honestly,
big scar.
yeah, right. And if you saw me before and then see me now, it's like 2 different people.
Wow. Congratulations. I'm glad you're doing so well.
John,
So
a question for John, Dr. Saab. Are you still taking medications?
Yes, I still take 1 milligram of my immunosuppressant, tacrolimus, twice a day. And that's all I take because Jason's organ was really a great match for me, size and everything else. So I've been very fortunate so far, and I have not had any problems so far. So I'm hoping to keep that going for at least, 20 or 30 more years.
God willing.
Wonderful, wonderful.
Yes.
Thank you, John. Wonderful presentation.
Thank you.
Farah?
Yes, so thank you so much, Mr. Moan, for his presentation and the wonderful efforts that he and One Legacy put in to save lives. I hope that that this presentation, this program, help everybody to get to know One Legacy and hopefully sign up as an organ donor. I also want to thank, of course, John. We just thank you, but again, thank you so much. This kind of stories really bring the point home that how many lives were saved with just one person deciding to donate his organ. I also want to thank Dr. Saab for his wonderful help as usual. Dr. Saab, I know you're extremely busy and I really appreciate your help and support. And again, thank One Legacy, our sponsor. This website you see on the screen are for One Legacy. Please, one is for their foundation, one is for the One Legacy site. You can go on there and you can figure out how to donate organs or sign up to donate your organs. And remember one thing that we wanted to talk about, that unfortunately didn't get a chance, that there is also the living donors. Maybe Dr. Saab, you would like to say something about that?
So live donation accounts for a small percentage of liver transplantation, and the donor and the recipient are both looked at very carefully to minimize any complication, particularly to the donor who's absolutely healthy. They usually take a part of the liver out and give it to the recipient, and both are followed. It's fascinating, but the livers in both the recipient and donor become normal size in a matter of a month to 3 months. But there are risks involved to both the donors. So that's why it's done with much precaution and much scrutiny. But it is an option to select people.
I knew of a father who, a couple of fathers actually, who donated a portion of their liver to their children, because the children were in need of. And I know that it worked well and worked very great for everybody. Although, as you said, they have to be very careful about live donation. Okay, at this point, I'd like to remind everybody that on May 11th, we have another webinar. This one is going to be on hepatitis. We are going to explore all variations of hepatitis. Dr. Saab will be our MC, and Dr. Ayub from Cedars-Sinai is our speaker. Please, to see the list of our programs, visit our website, liverhealthfoundations.org. And to sign up for programs, when you go there, you will see a tab that says program. We are very active on social media. And please join us, like us, retweet our tweets, and help us get the word out there to liver patients and everybody else. Thank you again to everybody who attended, and thank you to our speakers. Thank you, John, and thank you, One Legacy and Tom, and thank you, Dr. Saab. With that, I have to say good night to all. Stay safe and take care of yourself, and we will see you next month.
Thank you, Farah. Thank you, everybody.
Bye-bye.
Bye-bye.